Welcome to the New to Medicare Self-Service Tools webinar. This webinar covers information for fee-for-service Medicare. My goal is to have you look at the self-service tools and to get through the information you need to answer some pre-submitted questions, but also to help you understand what you should be looking for or different items that you can use. Today I'm Tom Ryan with Provider Origin Education, and I'll be your presenter. Today I'm joined by Jennifer from my team, who will help with technical problems, questions put in the chat, any of that type of thing. Jennifer is also a clinician, so if you ask me a clinical question and I don't know the answer, we may have to rely on Jennifer to help out with that type of information. A little bit about this particular webinar. Again, the training material is available on our training center in the live events page today. Now, that will go away in just a few days, whether it's the end of today or whether it is tomorrow morning. Once that comes down, you do have to wait, and that usually only takes a couple of weeks, but we will post it into the encore presentation. That's why we're recording this today. Once it's in the encore presentation, we will post the PowerPoint again, and it's going to be available for approximately 60 to 90 days, just depending. Today, for this webinar, I will take any questions in the chat, and then we'll go ahead and ask those out as we get closer to the end. We'll have a time for that. Last, we will have a survey available, and this survey is important to us because it does help us understand whether you thought this information was good, whether you thought the information could have been more thorough, whether I went too fast, all those different types of things. Remember, this is a new to Medicare course, and so it's really aimed at those people who are 6 months or under with Medicare. So we really do want to try to get you guys through what needs to be done. So hopefully that makes sense to you. We will present that at the end after the presentation, but I want to make you aware of it and just remind you that we're going to do it. Couple of things to keep in mind. The presentation and the material that I present today are for information only. Because Medicare does change often, the most important information will be locating information versus trying to know all of the information. And that's why we're here today, is to learn about those resources and what may be of value to you. That also means I need you to take the time to put something into that chat should you want a resource or should you need help looking for something, and to know what you're looking for, okay? The information that I give will be based on today's information. What's accurate today could change within a matter of hours for us, so we know that. I'm going to give it based on the questions given. So if there's something that you put in the chat, I may ask you to give a clarification or additional information. Also, I want to remind everyone that the CMS website, and we will go through some information on there, is the official website for Medicare. We do offer guidance on the WPS-GHA website, but we are not the official website. That is the CMS website, and that's cms.gov. But we'll talk more about that as we go through. So what are we looking at today? We want to help identify tools to help you in your Medicare experience. Medicare can be a complex program. We've heard a variety of different people say that it's very complex, that it's too much, you don't know where to go. Once you get started, things start to become familiar, even terminology, and sometimes that becomes part of the issue. So our goal is just to help you get through that Medicare experience, to get through those resources and really increase your general knowledge so that you can hopefully find what you're looking for. We do want to look at why use self-service tools. It isn't just, hey, it's a great opportunity. We'll talk a little bit more about why you want to use them. We will look at some of the different tools that I personally find useful, and we're going to talk about those. And then we're going to enter into a section where, again, it's based on what you put in chat, and I can help you find different things. If you don't at that point put anything into the chat, I won't be able to help you, and we may end a little early. So let's begin with the base question. Why do I need to use self-service tools? And some of the questions that we got were similar to this, but in a different way. One person in particular asked, why doesn't customer service ever help us? Well, I'm not sure what you're asking of customer service, but we'll talk more about that and I'll actually give you some information on that as well. So the reason that you should use self-service tools, first, it does improve your experience because you can get what you need when you need it, regardless of the hour. So if you work really early in the morning or later in the evening and our customer service department isn't available, you can still find what you need. Now, sometimes that does have to have times where you will need to know, terminologies and different things, and that's what we're going to talk about. It does offer greater support of availability. We'll talk about that in particular with some of the secure sections and the secure items, because you can find what you want, for instance, status checks and all that without calling customer service. It does offer additional flexibilities. So there's more than one self-service tool, and that's important. You can use a phone system, you can use a computer. There's a variety of different options to get you what you need without being stuck into one area and always calling or always having to wait for that support staff there. It does lower support costs. Someone asked about this one in particular, and the reason that it lowers the support cost is that if you're using a self-service tool, if you're looking something up online, if you're trying to find the answer and you've got that answer, and let's say you bookmark it this time, you don't have to look as hard next time, or maybe you don't have to call and wait for someone to answer that question. That is actually more time effective. So that's what we're looking for there, which again, then leads to more productive staff. Ultimately, time saving and money saving is the goal. Now, CMS also says, hey, it's a goal for Medicare too, right? We want to save time and money. So if we can answer the questions that are complex versus what's my claim status, which is a non-complex question you can look up and find out on a system, that's what we're looking for when you contact customer service. So the real reason to use self-service tools when you talk about Medicare is that it is required. CMS prohibits our customer service staff from providing information that is available on a self-service tool. And I'm not sure how many of you are aware of this. Customer service is for complex inquiries. You need to make sure that you use correct wording. And this comes back to that base question where they said, why doesn't customer service ever answer my question? And I'm not really sure what you're saying to them, but I will tell you in the Medicare Administrative Contractor, Beneficiary and Provider Communication Manual, Chapter 6, Customer Service Program, Section 30.3, the triage process, it does say that customer service shall refer back basic questions that can be answered by the IVR or systems to those IVRs and systems. In other words, we can't answer self-service items. It's actually within the manual system. So it's important to make sure that you have that information available to you and that you're aware of it. It's not something that we personally have said, oh, okay, this is what we want. No, it actually came from CMS. It's part of our daily operating instructions. So let's take a minute before we go on, and I just want to show you again those daily operating instructions. So you're going to come to cms.gov, and this is your first educational tool. And you're going to go to Medicare, because that's what we're talking about. And then you're going to go to regulations and guidance. Inside there, you have manuals. Now, inside the manuals, on the left side, you'll have a manuals navigation bar, and there's 3 items within it. The first one is internet-only manuals, and that's where you're going to be headed. Once inside there, you're going to see, if you scroll down in the body, just a variety of different manuals. And I will let you know this is not all of them. There are additional pages. In particular, the information I gave you is from the Medicare Beneficiary and Provider Communications Manual 100-09. If we open it up, we then have to look through all the information. This happens to be Chapter 6. And inside Chapter 6, you're going to look for the triage process, and that's 30.3. Now, the reason that I bring that up is because when you're thinking about terminology that Medicare uses, sometimes this is what's going to throw you off, right? You're thinking, why can't customer service answer my question? You're not thinking it's a triage process. So there is a difference in how you're going to look things up, and that does carry throughout the manual system. Okay. Let's go back to our PowerPoint for just a second, because we're at our first section for slides, and I do want to talk just a couple of other questions. So I'll do a pre-submitted question, then we'll move on and see if you have any questions in the chat. Are there tools that you're going to use more often? And the answer is yes. There's a lot of tools out there for Medicare. Many of them we will not go through today because there's just too many to hit in an hour and even a full day section. So we're going to focus on the ones that I think that I found the most useful, that I think you're going to use the most often. So please keep that in mind as we go through the different tools. And that's why I said, put what you need in chat. If I don't have it in chat, I then cannot let you know which tools I think would be best for you. So that's one question. And is there a reason that some of the self-service tools don't give accurate information? Well, we're going to talk a little bit about some of these different things because some of the self-service tools are giving the best information they have available to them, and their reliance upon other things to update them. So as we get through that, we'll talk about some of those different options that you do have, but we'll talk more specifically about that as we go through. Those are the two questions that I had pre-submitted for this area. So I'll ask Jennifer if we have anything in the chat.
Tom, there's nothing in the chat as of now.
All right, so that's our basic questions. We got through the basic information. Let's move on a little bit more. So what are we going to look at today? Well, we're going to look at a lot of different online options. We're going to look at sources that you can get information. I will use a lot of different types of information for you. So first, we're going to look at some different online options that are not WPS, and then we'll focus on WPS a little differently. Now, again, we're going to use a couple of different websites as we go through. I do want to bring up that we will talk about the CMS website. Again, this is your big one. This contains all the rules, laws, regulations. It's the official Medicare website. Second, we're going to talk about the comprehensive error rate testing website. This website is for improper payments. The reason that I incorporated this website and some of the information that's on there was because some of you had questions on it. So we'll get through that. I was asked about specific federal laws. Now, I wasn't asked specific questions, so I'm not sure exactly what you guys were looking for with this one, but I did incorporate the Social Security Administration website for that purpose because that is where the laws are at. The Social Security Department of the Social Security Act is what creates the law. So that's why we put that website in. The Code of Federal Regulation is the codification of the law. So while the Social Security Act says this is what it is, somehow we have to translate that down. And that's what the CFR does, or the Code of Federal Regulations. So we did want to look a little bit more at that, again, hopefully to answer your questions. And last, I will focus on the WPS website. Now, there are some options that are not online. And if you're saying, hey, he just ran through a bunch of stuff and he didn't do anything yet, I know that. We'll get to these websites individually in just a moment. Other things that we will talk about, direct data entry. Direct data entry is a system that is used for the Part A line of business. That's people that fill in a UB 04 or 837I institutional transaction. And it is a system that they can access the system with. So it's the direct data entry system. They can actually access the claims processing system with it. So we'll talk more about that. We do send out email communications. These aren't online, but they are emails that come to you. And so we'll talk more about those. The voice response, the interactive voice response system. This is that phone that you call, you talk to, or you punch some keypads in, gives you some stuff. We'll talk a little bit about that. There is also something called the HIPAA Eligibility Transaction System, or HETS. I was asked 2 specific questions on that, so I built that in. And last, the remittance advice. This is definitely something that we send to you. Sometimes you can download it offline, but it is something else that is available as a way of explaining what happens with the claims. The first thing I do want to start with is to let you know that I do have slides for a variety of different items, but I'm going to go live and show you different items. So your slide deck will just be for support, just for support here. So let's get started back at the CMS website. And again, the CMS website, which would be slide, I think 13 for you guys, is cms.gov. Again, things that we've already looked at. One, the daily operating instructions. I do want to remind you how to get them. We're going to look a little bit further into them. So the daily operating instructions are called IOM, Internet Only Manual. You can search that. You don't need to go any further. You can say, I just want the IOM. Okay, well, what are you looking for? Well, if you don't know that it's the IOMs, the manuals, which is what you're looking for here, you may get a variety of other hits. You can do that, and then it's going to bring you right to that page. It's going to bring you to a variety of different manuals as well. If you don't want to do that search and you really want to see the full list of manuals, which may be helpful as you get started and you really get to see how CMS breaks things out, again, the way to see those manuals is to come to the term Medicare, then go to regulations and guidance. Inside regulations and guidance, look up manuals, and then internet only manuals. Okay. Now, the reason that I keep bringing you back to these is there's a lot of great information in here. So your basic general eligibility and entitlement information, that's who's eligible for Medicare. Your next one is your benefit policy manual. And I'm just going to open this one up. It's 100-02. This is your basic benefits and coverage for a variety of different services. Okay. So if you go through, you'll find all kinds of different services listed. As kind of an end result, and you can imagine Chapter 15 covered medical and other health services. This has a lot of the physician services and anything not listed specifically outside of that. So I really would recommend, if you're looking for like a PT, OT, physical therapy, occupational therapy, speech language pathology service, it's probably going to be in this covered medical and other health services. So if nothing else fits, come to Chapter 15. One of the questions we had is there a list of items that are never paid for by Medicare? And there's not a complete list, I guess, is what you're talking about, but the general exclusions from coverage will go through that information. So if something is listed in this general exclusion from coverage, I would recommend taking a look at Chapter 16. I think it's super helpful, and it kind of talks about all the different things that you have to know when you're looking about, services that will not be part of the Medicare program. Okay. So let's jump out of that one. And again, that's the benefits manual, the benefit policy manual. We're going to move on to 100-04, which is the claims processing manual. This manual does talk about general billing guidelines and all the different things you need to be aware of. So yes, we do start with general billing, and yes, this is applicable to everyone. But then it goes through and breaks certain types of billing out to make sure that we are getting certain types of information, just like the other one does. Two things I want to point out for you when you get to this one is to scroll down until you get to chapter 24, 25, and 26. 24 is the one that mandates electronic billing and talks about that process and the things you need to be aware of. 25 says if you can bill on paper and you bill on a CMS 1450 or UB04, here's what you have to do to complete that form. Similarly, 26 says if you're billing on a CMS 1500 claim form, here's what you have to do to complete that claim form. Now, some people say, oh, I always bill electronically. I didn't even know I could. A lot of other information will come up, and there's different things you need to be aware of. There are exceptions that are listed in Chapter 24, which would allow you to look at 25 and 26 and complete a paper claim form. So I wanted to make everyone aware of these because I did have, and had a couple of people ask me for instructions on submitting claims. I'm not really sure what you're looking for. Electronic basic claim instructions are here. Paper claim, paper claim. It just depends on the type of paper claim that you submit. So hopefully that helps you a little bit there. Again, if you need more and I'm not hitting what you need from that, please put that back in chat. So I do, again, think these are super, super, super helpful. When you're inside something, I just want to remind everybody that when you look at different things, you'll see a variety of different items. Let's do the Medicare secondary payer manual. So while this talks about general claims processing, if you're looking for when there's a primary payer, okay, there are times when Medicare has to have someone process a claim in front of us. And that's very common. So this just walks you through all of those situations. That is Medicare secondary payer. There's some other entity who has to pay in front of us. It could be an insurance, like an employer group health plan, but it could be something like a store that doesn't have liability insurance. So therefore they're paying self-insured. That's also a Medicare secondary payer situation. I was asked a few different questions on that. So I thought better bring that one in and kind of get you guys where you need to go. I will give you a little bit more information if you would like that a little bit later on. As a reminder, when you look at this and you're saying, what's this secondary? Because it says chapter 2 general and chapter 1 general and chapter 1 crosswalk. So there's two different sections. There used to be, here at WPS, we called it the closet. Some people did not. But there used to be paper manuals, and they would mail out the manuals, and you would have to go through the manual and update the paper sections. So this crosswalk simply tells you where the old paper manual sections were and what are currently inside the general manuals, these chapters up here. I personally have never used the crosswalks. I don't find them super useful, but you may. And that's up to you. So if you want to find out or you're familiar with our old paper manuals, that's what a crosswalk is. All right, a couple other things I do want to point out on the CMS website. A couple of you asked for education and training information, and one of the interesting parts about that is it's not necessarily in Medicare, though it can be. It is normally in training and education. And what you'll want to do then is look at the different items that you have available. My biggest one personally is the Medicare Learning Network, which is this one. And I like the resources and trainings. So you can see I've kind of moved there. And then I go to publication. Now you can look at web-based trainings if you need that. Some of those actually offer certificates and you can get some CEUs and things like that with them. But for me, it's the publication and multimedia area. And so when we look at these different things, you can find out a variety of different items. So I was just explaining to you, there's this whole big thing called the Medicare Secondary Payer Manual. Got a lot of information in it. If I want a starting point for Medicare Secondary Payer, what I'm going to do is type secondary or start. You can see it filters. And then in this case, I'm going to look at a booklet. Why do I choose this booklet? Because it's going to give me a lot of information. It's about payment policy and explains things. What's great about the booklet is it's a lot easier to read than all those different manuals, but it's only a starting point. Okay? So let's scroll down for just a second and actually open the booklet. One of the reasons I chose this one is because someone asked if there was a quick reference tool for when to bill Medicare as primary. And so if you come to page 4 and it begins on page 4 and scrolls through this booklet, this is your quick reference tool. And it talks about the type of insurance, things like that, and then whether Medicare or the insurance is primary. So that's the quick reference that you asked me about. So hopefully that answers that question for you. Okay. Another interesting item that people forget about is way at the top up here, and it's in the About CMS area. So they're used to going to Medicare, they're used to looking for something, and then they say, well, how do I contact CMS? Well, that's not necessarily in Medicare because that is About CMS overall. And so you'll click on About CMS, and then you can see that it changes the page and gives you a variety of different things you need to know, and one of them is the Contact Us section. From there, you can use the contact database or you can use the contact page. I just like the contact page. For me, it's a little easier, but you can do whatever you want to do there. And you can scroll down through and find all kinds of contact information for regional offices, etc. So hopefully that answers your question about how to contact CMS. I think it's a great opportunity to do that. Okay. Another question I did receive about is policies and where are they housed? Keep in mind that we do link from policies on our website, and I will talk more about that, but they're actually housed on the CMS website in the Medicare coverage database. We do have 2 types of policies within Medicare. One is called a local coverage determination, and the other one's called a national coverage determination. Easiest way to find that is simply search MCD, Medicare Coverage Database. Once you're familiar with that terminology, you'll be able to come right to the search function without having to go further. Okay. Now that doesn't mean you couldn't go under the term Medicare, scroll down and be like, what am I looking for? We're going to look for coverage in this case. And the second link on the left column is the Medicare coverage database. So take it to the exact same page. From here, you can search within the database, look around the database, do whatever you want to do, and you can find a bunch of information. Please remember to set your state. It will narrow down a lot of the information that's coming back. So if I say, okay, I'm in Indiana and I'm looking for foot care, it will actually narrow down foot care for me so that I can only find things related to the state of Indiana. So please remember to do that, but this is where you want to go. Make sure you accept your agreements. Tells you, hey, this is a billing article. This is not in reference to a local coverage determination or a national coverage determination. It's just a billing article. All right. The last one on that we had a question come in on, I'm going to go back for a second here, on the CMS website, cms.gov, is just some fees information. I wasn't entirely sure what you were looking for with the fees, so I thought the easiest way is just to show you the payment area and then to say all fee-for-service providers. Now remember, when we talk about fee-for-service providers, we are talking about Medicare Part A and B. So again, Medicare, payment, all fee-for-service providers. Once you open that up, look down the left column and you're going to see a variety of different types of things you might want to know. So I'm not really sure what you were looking for there. If you scroll down, you will see a listing of all fee-for-service payment methodologies. So if I could get you to throw into chat what you were looking for, I might be able to help you further on that one. Okay. All right. The next item that we would like to look at here is I'm going to do a different way of finding it than some people are probably familiar with. What I'm going to do is to open a new tab, and I'm going to Google search. What I'm going to Google search is CERT website. Now, the question that I got is, what is CERT and how do I get a request from it? Well, you can see if you just search it, it brings up a variety of different things. The one that we're looking for ends in cms.gov. So this is the website we want, and it says CMS right there, Center for Medicare and Medicaid Services. The reason that we bring this in for a new to Medicare is one, the CERT contractor is a medical review contractor. They may ask you for medical records. If they ask you for medical records, you must respond. They create a national paid claim error rate. So depending on what you're looking for, it is called the C3 Hub. This is on your slide. And you can look through all the different things that they have available. But if you're looking for the sample request records, this is going to be on the left side, about halfway down. The documentation request just below that. But here's your sample request letter. And then it gives you examples of the request letter and what the envelope will look like. So this is one thing to be aware of if you're looking for that resource and you're not sure what happens with the CERT website. Remember, you can type CERT website, you can type C3 Hub, but you're looking for the one that ends in cms.gov or the word Medicare. Not really sure where to go from there on this one, but just to point out a couple of other things about this. They do have an electronic portal. This is a separate contractor than the Medicare administrative contractor, which is who we are. So you can submit records directly to them, but you do have to use their portal. Again, it's in the C3 Hub, and that's how you're going to do it. So when you do any of these methods, if you need to look at maybe an attestation letter or maybe a sample documentation request, any of these types of things are going to be available. I think that, and probably Jennifer would agree from a clinical standpoint, come to your documentation request and see what's going on. It is broken out by durable medical equipment, Part A line of business and Part B line of business. And it will walk you through what they're looking for in each type of documentation that they're requesting. So I think those are just great things to be aware of. If you're looking for behavioral health information, check out psychotherapy notes. I'm just going to walk you through what they need for psychotherapy. That is that website in a nutshell. Again, very quickly, if we're moving on from there, I would like to move on to the Social Security Administration website. Now, this one's a lot bigger than what a lot of people think, and it's because it is where the law is focused. So sometimes we can start off and we want to say, hey, it's in a certain section of the law. We could also just search Social Security Act. Oh, I'm sorry, I should type that out. Social Security, if I can spell Act, let's just say, we'll grab this section right here, and it's going to walk you through all the different sections, okay? Now, again, it is on the ssa.gov website. That's where you want to go. I'm going to open up section 1861 because this is your general information chapter. It's the one that kind of walks you through a section of information to say this is covered, this is what's covered, this is what's covered. Section 1862 is another important section because that's the one that talks about medical necessity. So 1861, you can see it opens up, it gives you all the information you need up here. What's great about it is if you don't want to read through all of this, you can use Control F and search for certain things. So if I wanted to say ambulance, just as an example, it will bring me down and says, okay, I'm in 7. And I just have to scroll up to figure out which section, but it does talk about the benefits and coverage within this section. If you're not sure what you're looking for, I'm going to tell you that you're going to go to the Social Security Act and go to Title 18. So take off this extra section, 1861, and instead you want to go to Title 18. Okay. Now this one in general is going to be a bigger area for you because it's going to give you all the different sections. And this is where you just kind of need to look for. Health insurance for aged and disabled is Medicare, aged and disabled. And then you just got to find the right section that you need. So you can see there's a lot of different stuff that goes into this. So I'm not really sure what you'd want out of this. 1861 was one area, and again, we were looking for those excluded services, and that's what 1861 will give you. 1862 is more about the medical necessity portion. So we'll scroll down just so you can see that. And it's just the exclusions from coverage from Medicare as secondary payer would be 1862. So exclusions from coverage and the Medicare secondary payer information. And it's two sections, A and B. A and B. But again, there's a lot out there within this law. Not always the easiest to read, and sometimes you do have to ask for legal advice on this one. Some of the words they use and things like that. So for people that aren't familiar with the law, I wanted you to be aware of it and have a little bit about it, but without getting too in-depth into it. Okay. Sometimes you'll hear people reference the Code of Federal Regulations, or the CFR. And this one is important because it takes the law and it codifies it, and it tells you the intent of CMS. Oops, of course I didn't type. We're just going to go to the eCFR, electronic CFR homepage. Again, you will have a link to this, but this is a way of finding it so that you don't have to worry about, in the future, what can I do, what can't I do? The eCFR is just a version of it, and you can see there's a lot of different items within it. And what you're looking for is to scroll through under the federal government and find the section that would be for Medicare. So if we're looking for this, what are we looking for? What was that title again? Anyone? So Title 18? So we think, oh, Title 18. No, that's not it. And so then you just have to kind of scroll through until you come up with what you need. And again, I forgot the title for this one. So but whenever you open this up, you'll be able to look through the different titles and the different information and get through the different stuff you need, Postal Service Protection. And this is all based in the federal legislation. I'm sorry, the federal area under the president. It's all the different people that work for him. Okay. If you're not familiar with that, you can type eCFR Medicare, right? And it'll say, oh, what do you want? Okay, so you're looking for 42. And then it'll bring you into public health. That's why I couldn't think of it. I couldn't remember the word public health. But then you can read through the general information on all the different public health areas and all the different penalties and things that go on. So there's a lot of information in here, okay? Make sure that you're in the right section for public health, because sometimes it won't be about Medicare, maybe about Medicaid, or it may be about one of the other areas under the Center for Medicare and Medicaid Services, or the Department of Health and Human Services. So you really want to make sure that you're hitting the Medicare program. You can see there's a variety of different things inside here depending on what you're looking for. So that's the CFR. Let's talk a little bit about our website, and we want to define the two different sections to get started. So we're going to move on to slide 17, and we're going to move to WPS's website. So this website, WPSJHA.com, has a couple of distinct sections I want you to be aware of. The first is the public section, and that's where we're at. This is available to anyone. Okay, so this is where you can come through. Now, this one is organized in a certain manner, and that's by departments within our organization. How can you find the information you're looking for related to that? So that's why we have a topic center, and we also have the jurisdictions. Now, these are line of business jurisdictions. So J5 is Iowa, Kansas, Missouri, Nebraska, and our providers across the nation. And then Part A represents the people that bill on a UB 04 or 837I. J5 Part B is Iowa, Kansas, Missouri, Nebraska, and people who bill in a 1500 or CMS, I'm sorry, 1500 or 837P. Indiana and Michigan is J8, and then it's just do you bill on a UB 04, 837I, or do you bill on a 1500 837P? So remember, when we're on our website, we're not talking about a service or a benefit category. Instead, we're talking about a line of business as defined by CMS. But the way that we've done this is to break up our website and give you some quick links. That's what this whole page is about. Yes, I know this is a labeled quick link section, but everything else out here is just a faster way of getting to something. It's what were you looking for? Down here on the bottom, you can sign up for that e-news that we talked about, and we'll talk more about that, but we wanted you to be aware of where to find it. Then you come back to the top, and this is where your navigation begins. The topic center is, again, where you're going to find most of the information related to claims processing. Okay, claims processing. So what are you looking for? Are you looking to start the process with provider enrollment? Are you looking for what medical review is going to do during the process? Do you need to submit documentation? Are you looking for basic documentation tips? Are you looking for claims? Okay, so ours is the topic center. Tools is exactly what it sounds like. It's all these different things that are available on our website. I wasn't asked about any specific tools, but just in general, what are tools, and that's what they are. They're things that will help you do different portions of your job, but they're available all over the website. So we combine them into tools just to make it easier. The training center is a universal section of the website. So unlike the topic center, which will change based on the selection you have here, the training center doesn't do that. It's one universal section, and it is where Jennifer and I have most of our information. It's how we do our jobs on a daily basis. So this gives you, our live events and what you can register for, get that material, all of those different types of things. The training center also has our encore presentations, and we did talk about that. I was asked about a list of resources that could help you as new people. Where can you go to get something that would just give you a list of resources? You don't want to have to try to dig it out. You don't want to have to try to do any of that. So if you scroll down, I do have an area on my website in the training center. It's called Specialty and Services, Training and Resources. By opening that, it's not a huge area, but it does have a variety of different items within it. And each one of these has a list of resources that may help you. So what are you looking for, and will this resource help you? Now, if you want a new page added, please email us and let us know what the page is. We obviously don't know what everyone needs, so we're kind of making these up as we go along. Not the resources, but what pages need to be done in a priority order. Let me just use I'll just use fraud, waste, and abuse. So if you're looking for information on fraud, waste, and abuse, maybe a training or some additional information, this will help you through that. Help you through all those different things. Each one works the same way. So let's say that we're looking for ambulance information and you want to know more about that. Here's the different resources that we have for that. Here's the different CMS resources, just a bunch of pieces of information that may help you. So again, it's a great resource or a great area in the training center. If you're looking for contact us, it's always going to be in the public section, and it is a drop down. So you can contact us and then you have to tell us, well, who are you trying to contact? What do you need from them? I will let you know that just like in the training center, you can see our contact information here as well. Each training center will also have this. So if you're looking in claims, you don't necessarily have to go to the drop down and select that. You can go and just look at the right side and see the same thing. Okay. This just means that there's a system problem or something you need to know about. If you select it, it will bring you to the systems page and it's going to tell you what's going on. Search feature. So that's our basic layout for the public section. If we move on, we have slide 18, which talks about the Secure Net Access Portal, or SNAP, and that is right here. This is the login section. It is something you must have a unique username and password for. We do offer a manual for this, and this is just, I selected the link for it. It's right under the unique username and login. I can't log into this, can't show you direct screens because there's too much protected health information and personally identifiable information within this system. Because this system does give you things like claim status. Duplicate remittances can be printed from here. It also gives you things like eligibility, but not just yes, they have Part A or yes, they have Part B. It's do they have primary insurance? Do they have all of these different things? And so that's important to understand. So this is one that answers a lot of the questions that you guys put in, and it is our recommended source. This is free for you to use so long as we process your claims. Okay, so if you come to the portal user manual, you can create an account, but if you don't know how to do that, go ahead and read how to register. Read how to register. Keep going through it. It'll talk you through all the different features and functions. The one that I do want to point out is just down here. It's called Patient. And the eligibility feature, we're going to move to this section in just a moment, but I do want to point out that depending on what you're doing as a provider, there are transactions for you, such as your claim status, or you're trying to file a prior auth, trying to get us medical documentation. What are you trying to do? It'll give you the directions. The reason that I wanted to point out in particular under patient and eligibility check is because a lot of people assume that this is just Part A and B when they get started, and it's not. Now remember, Part A is hospital insurance and inpatient, and Part B is everything else. So suppliers, Part B could be anything related to physicians, non-physician practitioners. It could be labs, ambulance, outpatient hospital care. That's all going to be your Part B stuff. So as we scroll down, what we find out is, yep, it's going to walk us through how to actually check everything, the required data. It's going to give you the results with what you need to know. In this case, we're going to focus on the eligibility section, not the supplemental insurance. That's the insurance after Medicare. But then it's broken down into a variety of tabs, and you can select each tab. The summary is available for you first. And then if you keep scrolling, it'll highlight around what you're going to find under each section. And it'll tell you all of that. So this is a great opportunity for you. I think it's something you definitely will want to take a look at. Okay. And that's SNAP. We were asked a few questions about direct data entry, or DDE. And I'm just going to put it in this way. What I'm going to do is look for an overview, which is down just a little bit. Now, the reason that I'm doing this is because direct data entry is not available for everyone. Direct data entry is part of the Physical Intermediary Standard System, or FIS, which means you have to be on a UB04 or an 837I to have access to this. If you don't, you cannot have access to direct data entry. To get access to DDE, you must use a vendor who then gives you information. So we do have some information out here on how to access it, a variety of different pieces of things. One of the things that I was asked about is that your DDE looks different than our manual. And let me explain why that happens. If your vendor customizes the information that you see or changes it, it will not look like the manual. It's not going to. You're getting something from your vendor, so you have to go back and ask them. So I wanted to make sure you're aware of that and answer the question related to that. One thing that everyone does commonly hear about is the e-news, or the electronic news that is sent out to you. So on our website, all over, we have different news sections. Scroll back up. And you can see those on our homepage. And okay, here's a quick reference to the news, right? Well, we also will send these to you electronically. This is in an email format. And Monday goes the Medicare news, or the first business day of the week. The first business day of the month, you'll get the policy updates news. Wednesdays are education schedule, and Thursdays are CMS updates. Now, there are some that are also sent out electronically, and they are sent out at needed times. So if there's an important message, we may send something out. As a reminder, I did show you that the e-news signup is down here on the bottom, and I do recommend that you do that. This will then allow the news to come directly to you. Whether you look at it or use it or whatever you want to do with it, it's a great opportunity. There's no requirement that says only one person per office can get it. It could be 200 people in an office. We don't mind that. So that's one of the areas you want it to be, we want people to be aware of. I was specifically asked about eligibility system HETS, and this is going to be on, oh, I'm sorry, I skipped the slide 21, which is the IVR. Now, slide 21 is the interactive voice response system, and I want to remind everyone that the interactive voice response is a phone number that you call. When you call in, you're asked for specific pieces of information, and what you will do during that is enter things to get claim status, enter things to get certain pieces of information. So if you want to know what you can get off of that, please come to the quick reference. And what you're going to do is look for the conversion tool, the IVR conversion tool. It's also going to be under tools, by the way. But when you open it up, it's just going to explain all of the operating guide and how to enter data. So you can read through all of this different stuff. The conversion tool will tell you how to convert someone's characters, like name characters, into the alpha that you'll need to enter. It just kind of walks you through all the different pieces of information. But I do want to point out that the IVR operating guide is available for you right up here at the top. If you go to search it, you can always search the IVR operating guide. Your little background, you can print the full version, anything you want to do there. Now, I will let you know that the IVR operating guide is different from Part A to Part B. Though these pages are the same, what actually prints when you select this link will be based on what you have selected up here. HETS is the next item. This is me on slide 22. This is going to jump back to CMS for just a moment. I forgot to talk about this when I was there. And if I type HETS, it will define for me what that is. The question that was asked is there a way to get eligibility without having to do all these different types of systems? And the answer is yes. It's called Connect Directly to HETS, the HIPAA Eligibility Transaction System. It is a 270, 271 transaction. This is the same transaction that our portal, our SNAP portal uses. If you want a direct connection though, you have to go through HETS to get that. And that will then allow you to use a vendor that's going to give you the 270, 271 information directly out of the eligibility file on the common working file or CWF, the same eligibility information that we get. Why is it important to know that? Because remember, the Social Security Administration or Railroad Retirement Board deems someone eligible for Medicare Part A and B. Then there is the Part C eligibility, which comes in a separate system. And all of that feeds directly into the common working file, which is what this 270, 271 transaction does, which is why some people like it better than using our system, but it is the exact same. All right, wrapping it up here, the remittance advice, a lot of you guys are probably familiar with remittance advices. You don't need me to talk about it, but it is a great way to get resources and to help with what you need to know. If you need to print a remittance advice, let's go back to our website, go back to the portal right here. You can actually do a duplicate remittance advice off of our portal. I think it's a great opportunity. So if you need one or someone in your office got it, but you needed it for whatever purpose, go ahead and scroll down and you'll find practice and keep going. I just got to find the right transaction. There it is. And then you keep going down and you'll find out all the way down and you can find notices, remittance advice and payment offset searches. This will help you through that, and it's going to help you download those remittance advice. This is what I was specifically asked about, is how you get a duplicate remit. You can call customer service, and there are times when the system will be like, nope, you got to call customer service. The reason for that is if it's too big, there's a restriction within our system on what we can give out inside the portal. And so when that happens, then you do have to call customer service, and then you have to mail it out. All right, well, that brings us to a couple of pre-submitted questions on slide 24, and then we'll move through what you guys want if there is anything. So I'm going to catch up here because we went through a lot of information, a lot of information. So as we get to slide 24, things to be aware of. How to find my way around the billing thing. I don't have a lot to offer on that. I'm not sure what the billing thing is, but that's why I did show you those IOM references. Please make sure that you're following the directions if you're looking for the paper claims. They do have some different instructions than will some of the electronics. So look at chapter 25 and 26. If you're looking for like modifier information or other types of information, that's going to be under contractor guidance, which will be on our website. So I always recommend, if you're looking for claims information, come to the topic center, go to claims, see what we have available. And you can see we do have categories broken out, and you can look through the different information. A lot of people ask us questions on modifiers. So say, oh, there's just one item under modifiers, and that's just a home page or a landing page. And inside that landing page, we do have a variety of fact sheets and items available to you. So that's going to hopefully answer those couple of questions there. We were asked specifically how to find Medicare secondary payer information and managed care information. And again, your three sources for that. SNAP will give that to you in the eligibility section. Direct data entry will give that to you in its eligibility section, its HIQA inquiry, and HETS will give that to you, the HIPAA eligibility transaction, if you use that system. So those are three different options, and they'll all give you what you need. Okay. Well, the next area that we have is, what are you guys looking for? So that brings us back to Jennifer to see if you guys have any questions or anything that you're looking for in particular.
The only question you had was about the crosswalks, and you did answer that one. And I do not see any other questions in the chat.
The crosswalks? I'm sorry. Oh, and the IOMs is when I was talking
Yes,
about
I'm
the paper.
sorry, the
Okay.
chapters with the crosswalks meant, and you did answer that question. Sorry.
Perfect. No, that's okay. I just wasn't really sure where that was referencing. So as long as we've answered it, I will keep going for you guys. So we've done the where. This is where we're at, the live navigation, but without any other things submitted, we're just going to keep right moving along here. Couple of things to keep in mind. There's going to be different resources that you need. And this is some of the different things I went through. I showed you how to find them. On the slide deck, you will see various items that are blue and underlined. If you're not familiar with that, it's really just a way of selecting it, and it will open the website resource that you need. So it's just a website link. It's a hyperlink. It's built in. So here again is that provider communication manual that you guys needed. Okay. So it really just depends on what you're looking for there. Oops, not sure what that little black box is, but we'll get rid of that. So a couple of different sections that are helpful. IVR help, the conversion tool, and the operating guide. Great. Certificate of Achievement. I want to remind everyone that WPS will email you after the event. It's going to look like what appears on the left side of your screen. This email is an automated email coming from our WebEx product. So long as you stayed on the event, you'll get the email. It's going to ask first for you to complete a survey, which is provide your opinion matters, and we want your feedback. And it's also going to give you down below a certificate and the certificate of achievement. WPS offers you contact hours. So you get one contact hour for this education today. That contact hour then is given to a governing body such as AAPC or NAC. They then decide if you get CEUs for that. We don't actually give you CEUs. We only give you a contact hour, but you want to make sure you get this certificate. If you dialed in, I don't have an email for you. A couple of things to keep in mind. I need you to email me, and I'll tell you about that in just a moment. Once you email me, you will have to incorporate a phone number, and the phone number has to have an area code. I can't track it without that, so I need the full phone number. And if we get that information in, we can then email you a certificate directly versus getting it automated. If you think of a question from today's event, you will have 7 days to email those to me. What I will do at that point is respond back to you and give you what you need. So you have until June 9th to do that. So today's day 1, we go 7 days out. And we're just looking for what do you need? What can you do for us? Now, and this is also how you're going to send me something if you want a certificate. So if you called in and you want a certificate, the email is there. Today's subject line is self-service tools, self-service, something like that. And you say, I need a certificate. I dialed in. Here's the phone number I dialed in from, and we'll get you that information. Okay. As promised, I'll talk a little bit about the survey. I want your good, your bad, and your ugly. What does that mean to me? First, I want to know what I did well. What areas did I cover? What areas do I need to cover? What did I do well? Second, what areas could I have done better? What could I have done to improve this education for you, whether it's a different PowerPoint, whether it was a more interactive session? Did you like the resources? That's what I call my ugly. So did you like my presentation? Did you like the resources that I showed you? When I did my display, did it help you understand what you needed? Hopefully it did, okay? So hopefully you got what you needed. Also want to remind you that you can take a survey right now. Jennifer put a link in the chat. Go ahead and drop right into that. Grab the survey link, take it right now. Awesome. However, you could wait until we close the webinar out, and you're going to get something like external, middle, lower middle. You're going to get an external website thing, and it's going to pop up and say, hey, go here. Their person wants you to go here. The host wants you to go here. Keep in mind, WebEx is telling you it's taking you to an external site. This is not spam. This is not malicious. This is nothing like that. Look at the URL, and this will always tell you you're looking for CMS Mac Fed Ramp. That indicates that it is the survey from CMS. That is the website CMS requires us to use. It's a Qualtrics survey. So that's where we're going to take you. I want your feedback so bad that I'm going to give it to you again in that follow-up email. But also, if you take the Encore, we're going to ask you again to rate the survey. And we're going to give you a picture like this that you can select and open the survey from that. So we really do want your feedback again, the good, the bad, and the ugly. A couple people continue to question, hey, what are we doing with that type of feedback? Well, a couple of things we have done is when you look at our YouTubes, you will see that we're adding chapters to them. And this helps make it navigation chunk by chunk. So instead of saying, I know Tom talked about the CMS website somewhere in the middle, he talked about the internet only manual. When you look at this one, we'll chunk it out. So if you open the description, you'll be able to find much faster what you're looking for. We also are adding training indicators, and these are slowly but surely working their way in. You'll see these in our ads, and the information just helps to tell you who it is about. I will let you know that a couple of things coming up. We are looking at how to redesign our website based on the feedback. Our website in particular is the training section. What can we do to make the training section better for you? So based on the feedback that we already have, we've got some ideas and some things in the works, but I always want to hear back from you on that. We don't have that one on the We Hear You slide because it's still a work in progress. All right. That brings us to the end of our webinar with everything that I wanted to talk about today. So I do want to thank you for your time. I hope that you did find some of this information helpful. As you begin in your Medicare steps processes, please listen to the other new to Medicare information we do have on our YouTube channel in our playlist. Remember, we do want to hear ways to improve. So it's important that you take that survey, give us that feedback, help us understand what you need. It isn't just about this education though. We do have a question where you get to look at WPS as a whole and tell us about that. You also have an open-ended question where you can give us any topic you want to see education on. It doesn't have to be about resources or anything related to new to Medicare. It's just what would you like to see education on. So again, take that survey and provide us that feedback. Don't forget to review our live events page and our encore pages, see what we have coming up, what's been recorded in the past. Oh, I see a little pop-up that just came up. Ask for a reminder of where to find that information on the website. Let me just jump back there for a second. So you're going to come to the WPSGHA.com website, Training Center. Key thing, go to the Training Center in the middle. Once inside the Training Center, scroll down. Now, if it's something going forward that hasn't happened or is about to happen or happened that day, live events. So for instance, this one, 6/3, new to Medicare, it's from 10 to 11 Eastern time, 9 to 10 Central time. Webinar materials is where you'll download it. Tomorrow, this will be gone. So what you will do is wait for us to update the encore presentation page. So here's one from 5/28. If you open that up, on the bottom, you'll see the follow-up down here, and this is where you're going to download the presentation. Hopefully that gets you what you need there. All right, I don't see anything else that came in. So I want to remind everybody, just again, take that survey, give us your honest feedback and help us understand what we can do better and what we can do for you. With that said, from myself and Jennifer, thanks for joining us today. We hope that you got some useful information from this presentation. You guys have a great day. We look forward to your survey comments, and you can now disconnect.